Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team, Dr. Joe Pizzona. Welcome to another episode of Balls Deep. As always, joined with the lovely Kat Williams. Kat,
I'm here.
how are we today?
I'm going to be honest with you. I'm tired.
Yeah?
Yeah, I got a new weight vest. Took it for a test run this morning. Somebody's legs are jelly.
Doing some rucking, huh?
Yeah, I guess you could call it rucking. You also could call it kind of a walk of sadness. But I made it home. That's all I can say.
What doesn't kill you makes you stronger.
Sure. So they say.
Awesome. Well, what do you have picked out this week for our episode?
So I want to talk today about kidney stones.
All right.
I am hearing a lot about kidney stones from people in your office, and I had a friend who went through this somewhat recently. Terrible pain, and she survived. But what are kidney stones? How do we get them? What do we do?
Yeah, great timing. Here we are in the dead heat of the summer in the
it's
South,
hot.
and
It's
hot and humid down here in Nashville. And this is prime season for kidney stones. So
Why is it prime season for kidney stones in the summer? Does heat have something to do with it?
well, why don't we dive deep into this with our main
Let's
segment
go.
of the show?
Balls Deep.
All right. So why do kidney stones form in the summer? So really this is, you could use either a cooking or chemistry analogy. If we think about, the main purpose of the kidneys is to produce urine. Okay. So get all the extra fluid out of our body that we don't need. And the other thing it does is it filters any toxins and minerals to kind of keep our body in that delicate balance that we need. Not everything that we put in has to stay in. We've got to have a balance of calcium and magnesium and vitamins and different things like that. And so if we think about it, if you got a pot of water, okay, and you start adding salt to it, if there's not much salt in there, you stir it around and the salt disappears, right?
Sure.
And so salt, if we remember from our chemistry days, is sodium chloride. So those sodium chloride little granules or crystals that we see in the form of table salt, when it gets put in enough water, stirred around, it turns into sodium and chloride ions. So they separate and they, quote, disappear. Well, if we add enough salt or we take out enough water, the salt will still be there. And that's exactly what goes on with kidney stones is it in an environment of not enough fluid coming through the kidneys while still filtering excess minerals. If those minerals turn into little salt deposits or crystals, then one crystal becomes a second crystal, becomes a third crystal, and they all grow in each other. And before you know it, you have now formed a kidney stone. So why in the summer? Well, we're dehydrated. We're losing fluid.
That makes sense.
And so as we've learned from previous episodes about how much we drink and how often we urinate, fluid in is usually fluid out. But in the summer, we forget we lose fluid through sweating. So that's an alternative way our body gets rid of excess moisture. And that's why in the summer, you're like, God, I drank a gallon of water today and my pee is still really yellow. Well, it's concentrated because you're dehydrated.
Okay. So what exactly is a kidney stone? Is it crystals, like you said, crystals of what?
Yeah. So
What makes up a kidney stone?
there are a lot of different types of kidney stones. I think most of us think of calcium as a form of kidney stones because there's that old wives' tale of if you have too much milk or ice cream or cheese, you're going to get kidney stones. We'll debunk that in a future episode here. But about 80% of kidney stones are made of calcium. Now, calcium has to have a dancing partner. Very few things are just made of 100% one ion. Because if you remember, we have positively charged ions and we have negative cations and anions. Again, back to our chemistry days.
It's a lot of chemistry I didn't learn, but go ahead.
So just like sodium has chloride to make table salt, calcium most often has oxalate, a mineral that's found in our diet that nobody talks about until you get a kidney stone. You can have calcium phosphate stones. And then there's a lot of non-calcium stones. Probably the most common one people may have heard of is called a uric acid stone. That's commonly known because it's associated with gout and eating excess meat, which we'll get into. There's some kidney stones that form from a whole bunch of minerals because of what bacteria are doing in the urinary tract. So there's an entire specialty devoted to all these different types of kidney stones and prevention of them and such.
But they all feel about the same.
Correct. Whatever they're
Which
made
is painful.
of, whatever they're made of, if they end up causing a blockage of the urinary tract, they will hurt. Now, we'll get into it a later episode, maybe some of the symptoms of kidney stones and how they hurt. But real briefly, kidney stones just sitting on our kidneys don't hurt us for the most part. They've got to be causing a blockage because the kidneys don't notice being scratched. What they notice is being blocked. When you block an internal organ, it really hurts. And anyone who's had indigestion or stomach cramps knows how uncomfortable that is. Well, multiply that by 100 and you've got a kidney stone because the urine is still being produced by the kidney, but it can't get by that stone that's causing a blockage. So the stones do form as little crystals up in the kidney on this area called the papilla of the kidney. And that's where the urine is being filtered through along with all of the minerals that our body's trying to get rid of. And if there's not enough fluid to dissolve those minerals and urinate them out, then they will actually crystallize, form a solid form, and deposit on the inside of the kidney. And then once you have one little crystal, it's now what we call a nidus, or sort of a foundation for forming a bigger stone. And that's how stones initially form and then grow and ultimately break off and cause a blockage of the urinary tract. And that's why these little buggers hurt so bad.
And that's when you have a big problem.
Absolutely.
Okay.
Yep.
So you've talked about very chemically what they're made of, how they form. What are we doing as humans to facilitate creating a kidney stone, which I guess then correlates into what do we need to stop doing?
Right.
What are the factors that create a kidney stone and cause all of this pain and problems?
There's no doubt a genetic component to kidney stones. There are some people who say, oh, mom had a kidney stone, grandma had kidney stones, I've got kidney stones. There are some genetic components and things that are
Are they
out of our hand.
hereditary?
So they're what we call polygenetic in most cases. In other words, unlike some syndromes where we know definitively, well, if mom's a carrier and dad's a carrier, I got a 25% chance of having this disease. It's not as simple as that. It's much more complex.
Okay.
What's also difficult to untie is how much of the kidney stones aren't necessarily due to genetics, but the learned behaviors and patterns we adopt from our family, right? So if you grew up in a house where water intake wasn't the norm, and instead you had glasses of sweet tea and Coke here in the South, then that's probably the primary reason you're forming kidney stones. It's not because mom and dad passed some genetics. They passed on to you that drinking sweet tea and Coke tastes pretty darn good.
Absolutely.
And water's gross, right?
Right.
So, it's hard to do that, but there is some genetic component, but I want people to realize that there are a lot of things that you can do that can either lead to kidney stones and or prevent them. But hands down, our diet plays probably the biggest role in kidney stones.
I had a feeling that was coming. So talk a little bit more about what are the negative things in a diet that might lead to a kidney stone, and what are the things we need to be eating to keep us from having a kidney stone?
Yeah, so I think we're going to dive into in our next episode kidney stone prevention, but as sort of just a general rule of why they're forming. Typically, it's an environment of not enough water. And we'll dive into, in this upcoming episode, some of the foods that you may be eating or contributing. I already alluded to a couple of them, but I just want people here to realize that for the purpose of an overview, your diet does play a big role in the formation of kidney stones.
So if you think this might be an issue, obviously you want to talk to a urologist. A urologist is a doctor who would treat and help you get rid of kidney stones, prevent them. Talk about your role as a urologist working with kidney stones.
So we're really the kidney stone experts. Not only, are we surgeons, so when you're really in need and help, we're the folks to call. But a lot of what we do in urology is also preventative. We really are, internists as well to a degree. In other words, a lot of urology is not cutting on people or putting tubes inside them. It's doing a thorough history and going through what are the dietary factors, what are the genetics, what is your kidney stone history, what kind of stones are you forming, how often are they happening, what sort of evaluation have you had? One common thing that I see is people come into my office, they go, oh yeah, I've got a kidney stone history. And I go, well, when was your last x-ray? Well, I've never had one. Well, then how do you know you had a kidney stone? Oh, well, I just knew, or the ER doctor told me. And so, there's a lot of myths out there around kidney stones and how do we diagnose them? So that's really where it's our job to dive deeper and do that good history, do an examination, order the appropriate testing to first determine, A, right now, do you have any kidney stones? And then if you do, what's going to be the best strategy to keeping them from getting bigger or getting them out? And then the second aspect, which is equally important, is doing testing to figure out why these stones are forming. Because you may have for example, a calcium oxalate stone, the most common type of stone, and your dad may get them as well. But you get them both for different reasons. And the way that we do that is a detailed 24-hour urine collection. So it's as fun as it sounds.
Not so fun, but okay.
We,
Means to an end.
We send an order to an outside lab facility. They mail a kit to your house with all the instructions. And essentially, I tell patients, pick a day you're going to be around the house and you're not going anywhere, because it's really important we collect every urine sample to get an accurate reading. We really need to know, how much urine are you producing? Because again, you have someone sitting in front of you, and I'm guilty of this as well. If you ask me how much I peed yesterday or how often, I have no idea. So what to get good results, we got to measure. And so we're going to measure the urine volume, but we're also going to send off a portion of that urine to this lab, and they're going to look at how much calcium is in there, how much sodium, how much oxalate, what's the pH or the acid balance of the urine. So again, we're going back to real chemistry here and looking at where do you fall in the range of these different factors. And then I can look at it with some expertise and go, hey, your problem is 100% water. We got to get you drinking more water, and we're likely going to stop these stones. In other cases, we go, listen, Kat, you're doing everything that you can. For some reason, your kidney is leaking out too much calcium, and we need to actually put you on a medication to bring that calcium out of the urine, get it back in your bloodstream so you don't form as many kidney stones. So it's really a nuanced sort of approach to it. And that's really what I want people understanding is there are ways to prevent this. We are here to help with this. And instead what happens is people just keep suffering with kidney stone after kidney stone, ER visit. Hopefully they pass their stones. If not, they see me to urgently get treated, and then they go off and forget about it. But if we look at the statistics, 1 in 10 adults are going to get a kidney stone at some point in their life. And of those who get a kidney stone, 50% of them are going to have a second stone within 10 years. So that's a lot of you out there, that are out there suffering and who probably haven't had a thorough evaluation with a urologist, who've not had a 24-hour urine test. So again, we're going to dive into the next episode with some practical kind of DIY things to help prevent it. But really the main goal here is to raise that awareness that there's a lot we can do.
That was going to be my next question. So if you have a kidney stone and you pass it or have a urologist help you manage it, how likely are you to get another one? Will you always get another one, or not necessarily? If you change perhaps your diet, your fluid intake, you're not necessarily destined to have this as a recurring problem, are you?
Correct. You are not destined to have this keep happening. Now, like everything in medicine and healthcare, everyone's unique. So I've got some patients who, God bless them, they get kidney stones every couple months. They're seeing me on a regular basis, and I'm doing everything they can. I test their urine, their compliance with our recommendations. They're doing everything they can. and the darn little buggers still happen. So there's some people who may be listening who are like, this is BS. I do everything and I still get them. And I feel for you. And yeah, there are some tough cases where we do the best we can and still you're going to get them. And then there are other people who are terrible with our recommendations. They don't follow a darn thing we have to say. They drink, 8 Mountain Dews a day, don't drink any water, and they get 1 kidney stone and never again. So, nothing is all or nothing in
Right.
healthcare. But certainly there are levers we can pull on that can lower the likelihood that you are going to get them.
Okay. Well, this was a lot of great introductory information on kidney stones, what they are, what they're made of, how they happen to us. Let's bring it down in my favorite part of the show, just the tip. So our takeaways today, I think, apparently 1 in 10 adults will get a kidney stone during their lifetime. And of those, 50% will have another stone episode. That's a lot of us. Number 2, diet plays a large factor in the development of kidney stones. And number 3, an evaluation with a urologist can help determine why your kidney stones are forming and help you take the necessary steps to prevent and treat. Did I get it?
Yeah, that's a great summary, Kat. And as you were saying that, I was thinking of one special but very important population are moms. So actually during pregnancy, a woman's at a higher risk for getting kidney stones because of all the metabolic changes that are happening to a woman during pregnancy, including pushing more calcium out through the kidneys. And so a lot of women are unfortunately introduced to kidney stones, not because they've done anything wrong other than simply they're carrying a little bun in the oven and their body goes through lots of fun changes, one of which can lead to kidney stones. So for all the moms out there who've had to not only push out a baby, but suffer with a kidney stone, God bless you. And certainly, drink your water during the pregnancy. And if you need us, we're here for you. So.
Motherhood.
Yes.
The gifts just keep on giving.
Yes, that they do. So, well, why don't we wrap up today, Kat? And Stream Team, it is always a pleasure. We are so excited to give you all this great information. If you find it valuable, please subscribe on either Apple or Spotify, or follow us on YouTube as well. And we really love questions from the audience. So if there's any comments, nothing is too silly or embarrassing. We see and hear it all. We'd love to answer your questions in future episodes. So until then, remember that we are all works in progress. Please show yourself a little bit more kindness because we all have opportunities to grow and get stronger. Thanks, team. Have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.